Medications can save you, but they can also harm you. Have you ever wondered, are the pills you take every day truly keeping you healthy, or are they silently shortening your lifespan? We often believe that medication is the solution to all health problems. Joint pain? Take painkillers. Insomnia? Take sleeping pills. High blood pressure? Take antihypertensive drugs. But few people realize that improper medication use after 60 can be one of the leading causes of stroke, kidney failure, memory loss, or even premature death. After turning 60, your body no longer metabolizes drugs as efficiently as it did when you were younger. The liver and kidneys work slower. The nervous system becomes more sensitive, and side effects can become much more dangerous. The concerning fact is that many people continue taking medications without fully understanding the potential risks. Are you taking painkillers daily without checking for side effects? Are you combining multiple medications without knowing they could interact dangerously? Are you using seemingly harmless drugs that could silently increase the risk of stroke, kidney failure, or memory loss? This article will help you. Understand the 7 reasons why taking medication recklessly after 60 can shorten your lifespan. Identify common mistakes that many elderly people make. Provide advice on safe medication use to protect your health. Offer natural foods that support the body when taking medications. Guide you on detoxification, proper medication intake, and effective lifestyle tips. Analyze the scientific mechanisms of how the body metabolizes drugs at different ages. Present medical studies on the risks of improper medication use in the elderly. Let's explore this now, for your health and the well-being of your loved ones. Reason number 1, weakened liver and kidneys. Drugs are not properly eliminated. Issue: after 60, the liver and kidneys function more slowly, reducing their ability to process and eliminate drugs from the body. This leads to drugs accumulating in the bloodstream for longer periods, increasing the risk of drug toxicity even at normal doses. Side effects and symptoms: persistent fatigue, nausea, loss of appetite, dark urine, yellow skin, yellow eyes, signs of liver failure, swelling, decreased urination, high blood pressure, signs of kidney failure. Serious consequences: if the liver and kidneys do not properly eliminate drugs, patients may suffer from acute liver failure, kidney failure, toxic buildup in the blood, or even death. Real life example: Mr. Peter and painkillers. Mr. Peter, 68, frequently suffered from joint pain and took ibuprofen daily. Initially, it helped relieve his pain, but after a few months, he began feeling fatigued, lost his appetite, and noticed dark-colored urine. Upon examination, doctors discovered that he had mild liver failure due to prolonged painkiller use. If he hadn't stopped in time, he could have suffered severe liver damage. Scientific research: a study published in the Journal of the American Medical Association, JAMA, found that patients over 60 are 3 times more likely to suffer liver failure due to NSAID painkiller use compared to younger age groups. Recommendations: avoid frequent use of painkillers without a doctor's guidance. Get regular liver and kidney function tests if taking long-term medication. Limit drugs that are toxic to the liver, such as acetaminophen and ibuprofen. Natural foods that support liver and kidney detoxification. Warm lemon water stimulates liver activity. Green tea enhances detoxification. Watermelon, grapefruit, and carrots contain enzymes that support kidney filtration. Reason number 2, dangerous drug interactions. A hidden threat. Issue: as people age, they are more likely to develop chronic conditions such as high blood pressure, diabetes, arthritis, and heart failure. This means they often take multiple medications simultaneously, increasing the risk of dangerous drug interactions without realizing it. Side effects and symptoms: sudden spikes or drops in blood pressure, irregular heartbeat, dizziness, blurred vision, drowsiness, disorientation, or confusion, digestive issues such as stomach pain, diarrhea, or constipation. Real-life example: Mrs. Susan and blood pressure medication. Mrs. Susan, 72, had high blood pressure and diabetes. She was prescribed beta blockers for blood pressure, but her doctor was unaware that she was also taking non-steroidal anti-inflammatory drugs, NSAIDs, for arthritis. This combination reduced the effectiveness of her blood pressure medication, causing her blood pressure to rise unnoticed. One morning, she suffered a mild stroke due to a sudden blood pressure spike. Scientific research. According to a study in the New England Journal of Medicine, more than 50% of elderly patients experience severe side effects due to drug interactions that they are unaware of. Recommendations. Always consult a doctor or pharmacist before taking new medications. Review your medication list to avoid dangerous interactions. Use medication tracking apps to check for cross-reactions between drugs. Avoid self-medicating with over-the-counter drugs without medical advice. Reason number 3, abusing painkillers. A double-edged sword issue. As people age, they often experience joint pain, back pain, or sciatica. Instead of seeking long-term treatment, many rely on painkillers, particularly NSAIDs, ibuprofen, naproxen, or opioids, tramadol, morphine. Side effects and symptoms: liver and kidney failure, stomach ulcers, increased risk of heart attacks and strokes, drug dependence and addiction, dizziness, confusion, and increased risk of falls. Real-life example: Mr. Robert and opioid painkillers. Mr. Robert, 75, suffered from severe arthritis and took opioid painkillers daily. Initially, he felt relief, but after a few months, he needed higher doses for the same effect. He also started feeling fatigued, had trouble sleeping, and showed signs of depression. Upon medical examination, his doctor warned that he was developing opioid addiction, a dangerous condition that could lead to respiratory failure and death. Scientific research. A study published in the Lancet Medical Journal found that long-term opioid use increases the risk of death in the elderly by 70%. Advice: limit the use of painkillers unless absolutely necessary. Consider alternative treatments like physical therapy, yoga, and massage. Use natural anti-inflammatory foods such as turmeric, ginger, salmon, and olive oil. If painkillers are required, strictly follow the prescribed dosage. Reason number 4, abusing sedatives, risk of dementia. Issue: after 60, many people suffer from insomnia, anxiety, and stress, leading them to rely on sedatives or sleeping pills. However, long-term use of sedatives can impair memory, cause confusion, and increase the risk of dementia. Side effects and symptoms: decreased concentration, forgetfulness, and confusion, prolonged fatigue, and daytime drowsiness. Loss of balance, leading to a higher risk of falls. Increased risk of Alzheimer's and cognitive decline. Real-life example: Mrs. Linda and sleeping pills. Mrs. Linda, 70, struggled with chronic insomnia and started taking benzodiazepines like Xanax, Valium, Ativan every night. After a while, she noticed worsening memory, frequently misplacing things, and having trouble focusing on conversations. Her doctor diagnosed her with mild cognitive impairment, an early sign of Alzheimer's disease. Scientific research. A study in neurology found that elderly individuals using benzodiazepines long-term have a 50% higher risk of developing Alzheimer's. According to the American Geriatric Society, prolonged use of sedatives negatively affects the central nervous system and accelerates brain degeneration. Advice: minimize the use of sleeping pills and sedatives. Use only when absolutely necessary. Opt for natural sleep aids such as meditation, yoga, light therapy, and sleep hygiene adjustments. Use herbal remedies like chamomile tea, honey, and lavender essential oil. If medication is required, take the lowest effective dose for the shortest duration possible. Reason number 5, misuse of blood pressure medication, risk of stroke. Issue: high blood pressure is common in older adults and is typically managed with medication. However, improper use of antihypertensive drugs can cause blood pressure to drop too low, increasing the risk of stroke or fainting. Side effects and symptoms: dizziness, especially when standing up too quickly, rapid heartbeat, weakness, and fatigue, increased risk of falls due to excessively low blood pressure. Real-life example: Mr. John and blood pressure medication. Mr. John, 75, was prescribed high-dose blood pressure medication. One morning, he stood up too quickly after waking up, felt dizzy, lost balance, and fell, hitting his head on the floor. He was diagnosed with a mild traumatic brain injury. Scientific research: a study published in the British Medical Journal, BMJ, found that elderly patients overdosing on blood pressure medication have a 30% higher risk of falling. Advice: never adjust your blood pressure medication dosage without a doctor's approval. Take medication at the same time every day for consistent effectiveness. Stand up slowly after waking up or sitting for long periods. Combine a healthy diet and light exercise to naturally regulate blood pressure. Reason number 6, misuse of antibiotics, the risk of antibiotic resistance. The issue: elderly individuals are more prone to infections such as pneumonia, urinary tract infections, and sinusitis. As a result, many self-medicate with antibiotics whenever they experience symptoms like coughing, fever, or a sore throat. However, the misuse of antibiotics can increase the risk of antibiotic resistance, weaken the immune system, and destroy beneficial gut bacteria. Side effects and symptoms: diarrhea and stomach pain due to gut microbiome disruption, fatigue, nausea, and loss of appetite. Reduced effectiveness of antibiotics when needed for severe infections. Real-life example: Helen and uncontrolled antibiotic use. Helen, 74, frequently caught mild colds and would take amoxicillin without a doctor's prescription. After years of misuse, she developed a severe lung infection, and doctors found that she had become resistant to multiple common antibiotics, making treatment extremely difficult. Scientific research: according to the World Health Organization, WHO, antibiotic resistance is one of the biggest medical challenges of the 21st century, with elderly individuals increasingly affected due to antibiotic overuse. Advice: only take antibiotics when prescribed by a doctor. Do not use antibiotics for common colds and flu, as these are caused by viruses, not bacteria. Strengthen your immune system naturally with foods like yogurt, garlic, ginger, and honey. Reason number 7, uncontrolled use of dietary supplements, hidden dangers. The issue: many elderly people believe that taking dietary supplements is the best way to compensate for nutritional deficiencies and maintain health. However, improper use of supplements can lead to vitamin and mineral overdoses, increasing risks for heart disease, kidney damage, and liver problems. Side effects and symptoms: excess vitamin D can cause bone loss and kidney stones. Overconsumption of calcium may lead to artery calcification, increasing the risk of heart attacks. Unnecessary iron supplements can cause liver damage and weaken the immune system. Real-life example: Daniel and calcium supplements. Daniel, 70, feared osteoporosis and took 3 calcium tablets daily without checking his blood calcium levels. After a year, he suffered a mild heart attack due to artery calcification, a dangerous side effect of excess calcium. Scientific research: a study published in the Journal of the American Medical Association found that unnecessary vitamin supplementation can increase the risk of cardiovascular disease in older adults. Advice: check vitamin and mineral levels before taking supplements. Prioritize a balanced diet over supplements whenever possible. If supplementation is necessary, follow the recommended dosage prescribed by a doctor. Use medication wisely to protect longevity. After age 60, the body undergoes significant changes that affect how medications are absorbed, metabolized, and eliminated. Medications that once benefited you in your younger years can become hazardous if misused. As we've seen, improper medication use can lead to liver and kidney failure, strokes, dementia, and other severe complications. Key takeaways: do not self-medicate with painkillers, antibiotics, or supplements without medical advice. Always check for potential drug interactions when taking multiple medications. Be cautious with sedatives and sleeping pills as they can lead to cognitive decline and memory loss. Regularly monitor blood pressure, liver, and kidney function to adjust medication use accordingly. Instead of relying solely on medication, adopt a healthy diet and active lifestyle to manage illnesses naturally. Remember, the best way to extend longevity is not by taking more medications, but by using them wisely and responsibly. Work closely with your doctor, stay informed about medical advancements, and always prioritize your health. You have control over your health. Make smart choices to live a healthier and longer life. Have you ever made mistakes when taking medication? Do you have any tips for safe medication use? Share your experiences in the comments so we can all learn from each other. If you found this post helpful, don't forget to like and subscribe to the channel for more valuable health insights.